Morning, and thank you for joining us today. My name is Lori Nance-Cavill, and I'm the first Vice President Treasurer of the Ontario Public Service Employees Union, known as OPSEU SEFPO. With me today is Sarah LaBelle, the Chair of the OPSEU SEFPO Hospital Professionals Division, and France Jolina, the NDP MPP for the Nickel Belt and Health Critic. OPSEU SEFPO proudly represents more than 25,000 members in over 250 hospital professions in Ontario's public hospitals. And when I say over 250 hospital professions, I'm talking about the full team of professionals that it takes to provide care to patients. This includes radiation technologists, cardiovascular perfusionists, radiation technologists, occupational therapists, physiotherapists, respiratory therapists, and so many more highly skilled professionals. I mention these professions today, the full team, so that we can take each and every one of them into account when we discuss issues like staffing crisis in hospitals, hospital underfunding, and Bill 124, which continues to suppress their wages while they work at full capacity to take care of Ontarians. Sylvia Jones, our Minister of Health, has rejected the notion that we have an unprecedented staffing crisis in hospitals, and Premier Ford has refused to repeal Bill 124, which we are currently challenging in court. In response to the problems that plague our hospitals, they choose to line the pockets of their friends. They would rather allow private, for-profit facilities to perform essential health care services, disguising privatization as innovation and opportunity, instead of taking the time to truly understand what is happening on the ground and speaking with hospital professionals to develop solutions. This is not dissimilar to what is happening right now with the CUPE education workers. The government has claimed that they are working for workers, yet they want to eradicate collective bargaining rights and force an agreement on workers who make an average of $34,000 a year in extremely high-stress, understaffed jobs. Enough is enough. Stop stifling workers' voices, strong-arming to get your will, and get to know the people that you were calling heroes not that long ago. If Premier Ford and Minister Jones took the time to get to know the full team of hospital professionals, they'd have the opportunity to speak to Linda, a physiotherapist in Ottawa, who has worked at the hospital for 27 years. Linda works in the stroke unit, helping patients who are recovering from stroke to rehabilitate and to get back to the comfort of their own homes. Linda's unit is higher staffed and higher resourced than most, but in her unit, there are still only 2 physiotherapists assigned to 40 beds. The average unit has 1 to 40 ratio. Linda spends her day working to her maximum capacity, attending to every patient that she can. Yet she still leaves work at the end of the day, feeling an immense guilt for the patients she's left behind. Patients who've been lying in bed all day, and she couldn't help get out of bed because she was on her way to care for someone else. Patients who she knows haven't been able to get out of bed for days on end and who will be susceptible to bed sores and low blood pressure, extending their hospital stay. Her unit is understaffed, so no one else is able to get these patients up and moving either. They're short of nurses, but they're also short of everyone else too, the full team of allied health professionals. Linda and her co-workers have used the word prioritize often, which is a horrible word when you're talking about the human beings that are in pain. You have to be in a life-threatening point to become a top priority. After 27 years, Linda, like many experienced health professionals, is choosing to retire early. She's burnt out and she can't take the stress anymore, mentally or emotionally. She has many valuable insights for how to address problems in our hospitals, but feels frustrated that the government is overlooking their voices of the front lines. It would also do Premier Ford and Minister Jones well to talk to Dan, a medical radiation technologist in the Kitchener-Waterloo region. Dan works in nuclear medicine department and takes on patients from neighboring hospitals because of lack of staff and resources in those hospitals. Dan does scans to patients to diagnose a wide range of problems, like tumors and other illnesses. There are sometimes 6-month waiting periods for the scans and tests that Dan's department does. And he works off of 3 general imaging cameras to meet his demands. Cameras that are all considered end of life. Some of these are close to 30 years old. When he asks for new machines to help meet the high demand for these scans, he's told to get in line with the rest of the hospital. Every department has requests for important resources they need to do their jobs, and the budget only goes so far. Dan and his colleagues work late into the evenings and on weekends to catch up on the backlog of tests, some of which only his hospital does and no others in the area. They are understaffed and working to the max with no end in sight. And with how busy the nuclear medicine department is, they don't have much time to talk to patients. The patients they're treating are often having, let's be frank, not the best day. More commonly than not, they're worried, anxious, stressed, sad, frustrated, and scared. Dan wants to take time to talk to patients, many of whom have just lost a spouse or who have been given a cancer diagnosis right before meeting him. He wants to listen to them and to be compassionate and to explain the healthcare process, but there's little to no time to do that and to stay on track with his workload. We talk about patient-centered care, but often it's not patient-centered if the human element is taken out of it. Linda and Dan's experiences echo throughout all of our hospitals, and they are the stories of the hospital professions that work in Ontario. Understaffing, high stress, heavy workloads, long wait times, backlogs. Hospital professionals who choose this profession because they care deeply about the people, but they can't work to their full potential because of the lack of resources. We're not going to solve this crisis by signing contract after contract with private for-profit corporations and creating a 2-tiered health system. Premier Ford would be wise to listen to the professionals, those that understand that creating a 2-tiered system does not build capacity. It isn't the solution. It actually exacerbates the staffing crisis and wait times in our public system and worsens patient outcomes. We can solve this crisis by investing in public hospitals and giving hospital professions a voice at the table and a voice in the allocation of the funding. We can solve it by increasing the hospital professional staffing, not only doctors and nurses, but the full team of allied health care professionals. And we can solve it by repealing Bill 124 so that hospital professions are paid wages that reflect the value of the work that they do. I would like to now ask Sarah LaBelle to speak with you about her experiences both as a healthcare worker and as well the chair of the division. Thank you.
Thank you, Lori. My name is Sarah LaBelle. I'm the chair of the Hospital Professionals Division, and I'm a medical laboratory technologist by profession. I've been working for over 20 years in healthcare, and most recently at Lakeridge Health, where I've been working for 18 years. Almost 20. Wow. Time flies in a pandemic, right? My experience at work and as the chair of the Hospital Professionals Division has meant that I have been able to talk to frontline healthcare workers across the province in my role as the chair of the Hospital Professionals Division. I worked throughout the pandemic. I volunteered to be redeployed, as many of our members did across the province. I went to help out in the microbiology department in order to meet the need for COVID testing. Our members did that throughout the province. The hospital professionals stepped up every single day, and they went above and beyond, and they continue to do so. Speech language pathologists went into our long-term care homes to help out with the patients and the care of the residents in long-term care. Our members volunteered to be redeployed to long-term care in extremely poor working conditions, but they did it because they cared about the residents in that community and they cared about the patients in their communities. And they did that without any thanks from the government. They didn't do it because they wanted thanks. They did it because they cared about the people that they were taking care of. They want to be respected, they want to be valued, and that comes from recognition from this government. We have heard an awful lot of staffing shortages and all of these solutions that the government is saying that they're putting into place, but it really only speaks to nurses, PSWs, and physicians. And 100%, we need more of them, but they cannot do their jobs if we're not in the healthcare system. Our members are the nervous system in healthcare. Our members provide the diagnostic information that allows physicians to diagnose and treat patients. Our members who work in medical laboratory technology, we have technologists, technicians, phlebotomists, pathology assistants, all of them work extremely hard every single day to diagnose. 83% of the physician diagnoses are based on lab results. Medical radiation technologists who do interventions in nuclear medicine, in magnetic resonance imaging, in X-ray, CT, they help provide the information that physicians use to diagnose and treat. Our members provide the therapies. Radiation therapists are the ones who, once we provide a diagnosis for cancer, they are doing the therapies. And they have been doing it short-staffed. They work double shifts. They come in the next morning. I worked 19 shifts in a row in November to provide COVID testing to my hospital. It's dangerous. I go into work and my colleagues tell me that they are crying on their way into work. They are breaking down in tears at work. They are crying when they leave. And they are crying not because they can't handle the work that they do. They're crying because they're burnt out. They're crying because they are bearing the brunt and the burden of a pandemic that has hit their colleagues and their coworkers and patients. My worst day in the pandemic, and I did not have a bad day like a respiratory therapist had a bad day, but my worst day was when I did the tests on a baby that was hours old and the baby was dead. That was my worst day, and I didn't take care of the baby. Frontline. The people who were there were our members, the respiratory therapists that intubated. Our members in this pandemic did everything that they could to keep people alive. They did it because they care, and they did it while risking their own safety. Respiratory therapists in the pandemic, before we went into the pandemic, were dealing with about 5 patients per respiratory therapist. It's probably stretching a little bit because if you have 5 patients code at the same time, there's no way that you can save all of them. In the height of the pandemic, they had over 11 patients per respiratory therapist on the floors. There was no way they could have saved them all. We brought in at Lakeridge Health in December of 2021, we brought in social workers and employee assistance program to sit down and talk to all of the workers about how they were going to have to make a decision who they could save and who they couldn't. And that was because we did not have enough workers to do the work. The false narrative that privatization is the solution to a staffing crisis is absolutely nonsense. I was going to say it like it is. You cannot create more health professionals by creating a parallel system. You create more health professionals by investing in schools, in programs, by encouraging young people who are coming in to the post-secondary system, encouraging them at an early age to come to these programs, to take them, to invest time. Our members are highly educated and skilled, so it does take time to train them. So now is the time that we have to solve this crisis. We have to do it now, because if we don't, we are not going to have enough people to do the diagnosis, to do the interventions, to do the treatments, and people will die. People died in the pandemic because we could not save them, but there are an awful lot of people who will die because we can't actually do the interventions that we need to do. And that is something, that is a choice. That is a political choice, and it doesn't have to be the option for Ontario. We have a world-class healthcare system. We need to invest in it. The public system is a pride. It's a jewel. It is something that other countries look at and wish that they had. So we need to build it up, rather than tear it down. And we can do that if we intervene now and we have a conversation with everybody at the table and the voices of the workers to talk about what we need to do to encourage people to come into these professions. In the beginning of the pandemic, in July of 2020, there were over 7,400 medical laboratory technologists licensed to practice in the province of Ontario. We are now sitting at just over 6,200. So we have lost 1,200 lab technologists. They have left the province, they have left the country, they have left their professions, they have retired, they have taken other jobs, they're opening wellness clinics, they are doing anything else but what their livelihood was for decades and that they love to do because they can't take it anymore. The workload is too much and there's not enough people. So we need to do this intervention now. It can happen with political will and desire to fix the problems, and including all health professionals, not just the 3 professions that I mentioned earlier, and I won't mention them again, but we have a lot of professions that have been doing the work. They have been redeployed to help out where there are nursing shortages, and they're continuing to do that. And we're here today to talk to the MPPs, to raise these issues that are forefront of our members. They want to provide solutions. They have solutions. They make suggestions in their workplaces every day. They just need someone to listen, and we need this government to listen. Thank you.
Thank you, Sarah. Thank you, Laurie. I want to thank everyone at OPSEU SEFPO who have worked so hard during the last 2.5 years of the pandemic and every year before this. There are 250 different professions that are needed in order for a hospital to continue to be the jewel that we can all be proud of, one of the best healthcare systems in the world. But all of this is at risk. Our healthcare system is in crisis right now. Those are people on the front line who shared a few little stories of what it's like. But you could ask any of those 250 different health professionals, they would all have stories to tell you that our healthcare system is in crisis. It cannot continue the way it is now. It needs investment. It needs a government who acknowledge that we have a health human resources crisis, and we need a government who is committed to public delivery of our healthcare system. We have none of that right now. Minister Joan has yet to say that we have a health human resource crisis in our healthcare system, and the only change she wants is she uses the word innovation. Put a red flag beside that. When she says innovation, she means private for-profit. They have already said that they intend to open a surgical suite in the private system to help with the backlog. None of this is true. Is it true that private for-profit will make a ton of money out of the back of sick people waiting for emergency surgery? Not emergency, waiting for surgery? Absolutely. They will make a lot of money. But what does that mean for us? It will mean that we will have to pay more because they always find a way to charge you. It will mean that we will wait longer because our healthcare resources are not unlimited. If you take a physiotherapist, if you take a respiratory therapist out of our hospital and put it into one of those for-profit clinics, she's not there no more. He's not there no more. We're not going to create new ones. And at the end of the day, the crisis in our healthcare system will get worse. Again, I want to thank Laurie and Sarah for sharing their story. I know that it's not easy. Most healthcare workers, and you can see by the way they speak, are there to help people. They very seldom advocate to help themselves. And right now, they're at the point where they see that their colleagues are burnt out. They see that their colleagues are trying really hard to meet the needs of the patients in front of them. And when they fail at doing that, they think of leaving their job. They think of, I cannot do that anymore. And just in medical laboratory technologists, we have seen a decrease of 1,200 in many other parts of the healthcare system, it is just as bad. And we're open to question. On peut prendre des questions en français également.
What's your reaction to Bill 28, and are you concerned about potential implications beyond education?
We are. We are very much concerned about it. If this government is willing to trample on the rights of the education workers, this will not end here. They've already trampled on everybody's rights in the public service under Bill 124, which is predominantly a female workforce. They implemented Bill 124. We were all concerned what that would mean after Bill 124. I mean, we've challenged it legally. However, if they are going to use the notwithstanding clause in order to just railroad through what they want to implement in legislation without any respect for democracy and for workers' rights, then I don't anticipate that they will stop with education workers. They will continue to move through other workers as their collective agreements come up, and we're very much concerned about that. We stand in solidarity with the education workers. Many of them are predominantly female. They were, low wage. They could not work from home, many of them in the pandemic, because of the nature of the work that they did. They also were frontline, coming into work, putting themselves at risk, and health and safety was, something they advocated for, so we 100% stand in solidarity with them. We did a day of action in 2003 over collective bargaining and our rights being trampled, and it was the Ontario Hospital Association that was trampling our rights at that point in time, so we 100% stand in solidarity with them standing up and defending their rights.
You talked a little bit about understaffing in the allied health professions, and you heard Sarah, you mentioned that lab techs down from 7,400 down to
6,200 is what we have
Is that
registered now.
kind of like pre-pandemic to now? Or was
that was during the pandemic. So in July of 2020, we had over 74 that were registered to practice in the province of Ontario, and now there's just over 6,200.
And they sort of left because I think you mentioned, was it burnout and...
Burnout. People are retiring early. People are leaving the province. We had one of my colleagues gave 2 weeks notice, just said, I'm out, moved to BC. She's a traveling technologist. She picks and does contracts here and there. And she bought a trailer, and she's traveling all around BC, and she's living her best life right now. She loves it, and it's quality of life. Right? She was done with the double shifts, coming in early the next morning and working tired, and now she just picks what days she wants to work, and she's traveling around, and BC's beautiful.
And I don't know if Lori or Sarah can answer this, but do you have numbers on some of the other allied health professions and sort of...
We don't yet. We're working with the different associations to get those numbers. It's harder to track a lot of the other ones because they don't publish that information, and a lot of them don't have an association that has full-time staff. A lot of them have volunteers, so we are working with them, and we're going to put that together, and we'll be releasing that information as soon as we have it for the other professions.
Okay, but it seems like it's understaffed, like you're low.
We are.
Across the board?
So in respiratory therapy, for example, one of my very good friends, her daughter graduated. They moved them through quickly. They were out doing their clinical rotation when the pandemic struck. They fast-tracked them and got them out working, and she was working 3 jobs in the pandemic to help meet the need in the GTA. She was working at 3 different hospitals, and all full-time hours. So they are very short-staffed in respiratory therapy. I know that for sure. Physiotherapy is another one. We're chronically understaffed. We have an aging demographic in medical radiation technology that CIHI released information in 2011 on the aging demographic for medical radiation technology and lab technology, and we're about the same age. So there is going to be a mass exodus in medical radiation technology as well.
I can tell you that for all profession as a whole, there are 34,000 jobs open in our hospitals right now for all professions put together.
That's helpful.
All allied health or all?
All allied health, that includes nurses also. Nurses, PSW, and all 250 allied health and rehab, all put together. There are 34,000 jobs open in our hospital, and there's 12,000 jobs open in a community setting. So think of long-term care, home care, primary care, etc.
speech language pathologist prior to the pandemic. It was taking hospitals about 3 years to recruit an SLP for a job in the hospital, and that was before the pandemic. And they were also key in the pandemic because when someone was intubated and they were ventilated, when they come off the vents, they need help with the physiotherapists help clear their lungs, help get them moving, but the SLPs help get learning to swallow again, helping them masticate and all that. So we very much burned through SLPs as much as other professions as well because they were working in all of the CCUs and the ICUs.
Do you feel unappreciated or maybe even disrespected by the government?
Yes, very much so. Every single time, and we absolutely 100% support nurses and PSWs and physicians, and absolutely there needs to be, some increase to funding to help them as well. But every single time they mention them and then don't mention any of the other professions, our members feel even more demoralized. Not getting pandemic pay really was a blow. It broke the team in healthcare. It really, was a wound that has not healed. And every single time now when they re-announce the $5,000 retention bonus, it's just picking at that wound that has not healed. And our members very much are wishing that they, worked in a different profession. And that's extremely sad because we need everybody in the healthcare system. We're a team. We have talked for so many years in hospitals about the interprofessional team, and that's what all the hospitals have built their care around. And now Doug Ford and his announcements broke that team, and it's hard to heal that.
I wanted to ask about violence in the workplace because more and more staff members in hospitals are reporting security issues, and I'm thinking recently about a weapons incident in Sudbury. Do you think hospitals are doing enough to protect their professionals?
No, they're not. They're doing what they can with the resources that they have, but they need to do more. I'll just give Lakeridge as one example. We built an emergency department that had doors that did not open properly so that people could get out of the emergency room quick enough. So the doors would open in. Well, if you're dealing with a patient who is violent or a threat, you don't want doors that open in because that is a way that traps someone. You want a door that opens out so you can get out. And so that was one thing, we had to fix that. And so it's just even in the engineering that we do that we're not addressing. We have tons of our members who work alone. They work by themselves on a shift. We had a medical laboratory technologist whose partner came in, and he was abusive. She had left her partner. He came in on a night shift, came into the lab, made it all the way into the lab and stabbed her. That was years ago, but that is the reality of our members who work in unsafe working conditions because they work alone many, many times. In small hospitals, in departments, they're alone. We have had technologists who have had to deliver blood products to the emerge department, and they've gotten locked and trapped in stairwells, and nobody knew where they were because they work by themselves in a department, and that happens very frequently for many of the professionals. They don't work on a unit a lot of times. They work multiple units, so they're moving through, and they get lost, and they're more at risk of violence when they're working alone.
Et France, si vous voulez commenter en français peut-être, on a entendu récemment à l'hôpital Horizon Santé Nord, il y a eu un incident avec une arme. Puis c'est un exemple parmi d'autres. Qu'est-ce que vous pensez de cette violence dans les hôpitaux?
Je dirais que si tu regardes les temps d'attente, les gens qui se rendent au service d'urgence habituellement sont très malades. Et quand on leur demande d'attendre 20 heures, 36 heures, 55 heures avant de recevoir les soins dont ils ont besoin, on est des êtres humains, ils n'en peuvent plus, ils sont malades, ils sont rendus à l'hôpital. Et là, on les fait attendre. C'est pas la faute de personne. Mais lorsque la première professionnelle de la santé vient leur parler, souvent, ça ne va pas bien. Le patient est fâché et sa colère, ça va être vers cette personne-là. Mais même une fois qu'on a identifié qu'un patient est violent, on va en prendre soin quand même. Un hôpital, ça prend soin de tout le monde, mais tu identifies sur le dossier qu'il est violent. tu penses que le moins qu'on pourrait faire, c'est de s'assurer qu'il y aura toujours 2 personnes qui vont rentrer dans cette chambre-là en même temps, juste pour avoir une protection. Si on sait dans une maison, il y a quelqu'un qui est violent, puis que la police est appelée, il n'y aura jamais un policier tout seul qui va rentrer dans une maison où est-ce qu'il y a de la violence. Il y en a toujours 2. Il y a toujours 2 personnes. À l'hôpital, on sait que parfois, il y a un patient très violent pour toutes sortes de raisons. Il y a les mauvais médicaments, il a commencé de la démence, il a besoin de soins, puis on va le soigner. Mais pourquoi est-ce qu'on n'est pas capable d'offrir aux professionnels de la santé le même niveau de protection que l'on offre à d'autres travailleurs qui font face à de la violence? Et ça, c'est pas là. Les professionnels de la santé le demandent et on n'a pas suffisamment de personnes qui travaillent dans nos hôpitaux pour être capable de les garder en sécurité. Et c'est une grosse raison que les gens partent. Ils ont vécu un événement de violence, ça les traumatise, puis ils disent « moi, je fais plus ça ».
Et peut-être juste en français encore plus généralement sur la crise du personnel, vous avez dit plutôt que le gouvernement ne reconnaît pas formellement ce manque de personnel. Si vous voulez reprendre en français un peu votre propos.
On a une crise des ressources humaines dans le domaine de la santé et dans nos hôpitaux. Laurie puis Sarah sont ici aujourd'hui pour nous donner des exemples précis de qu'est-ce que ça a l'air, le manque de personnel. On n'a jamais été capable d'avoir la ministre de la Santé admettre qu'on a une crise de ressources humaines dans nos hôpitaux, dans le domaine de la santé. Et quand on leur demande, il faut faire des changements, et encore là, on apporte les changements à faire. Le seul changement qu'elle nous parle, elle utilise le mot « innovation », mais ce n'est pas de l'innovation qu'elle veut faire. L'innovation, pour ce gouvernement-là, c'est la privatisation du système de santé. Ils ont déjà dit que l'on va construire des suites pour faire des chirurgies dans la communauté. J'ai rien contre les soins dans la communauté, c'est bien, mais ça va être des entreprises privées à profit à qui ils vont donner ces contrats-là. Puis ça amène toujours à la même chose. Ça va amener des frais, donc il y a des personnes qui ne seront pas capables d'y avoir accès. Ça va amener des délais plus longs dans le système de santé publique parce que tu prends une physiothérapeute dans l'hôpital puis tu la mets dans une clinique privée, elle n'est plus là. Et ça va vouloir dire que la crise dans nos hôpitaux va être encore pire.
Thank you.
All good? Merci.